Right. Hello, everyone. Thank you so much for having me. I really appreciate the opportunity to be here and to speak with you. I know a good number of you by name and reputation, and some others I work with very closely, and it was great to meet some new faces. So thank you so much for being here. Let me find my clicker and figure out what we're doing. All right off the bat, don't worry, I'm not going to read this slide to you. Um, I do work for the Wyoming Center on Aging, and if you're interested, you can read our mission statement there. But most broadly, I just want to let you know that we do a lot of work across the state. My specific area of focus is the HealthyU program, which is what I'm going to be talking about today with you. But just know generally that WYCOA does a lot of different programs. We have a team of regional coordinators that are funded through some CDC 1815 work, do a lot of chronic disease prevention work, a lot of Alzheimer's and dementia support type services, a lot of caregiver services. So if any of those realms or fields overlap with work that you all are doing, I'd encourage you to check us out or talk to me after the presentation. I can help you make some connections there. So before I really dive into what the Cancer Thriving and Surviving program is, I want to set the stage just a little bit for you about HealthyU. So as you just heard, HealthyU is what we call this suite of 4 different chronic disease self-management programs. The first one that you see there is so well named, CDSMP, the Chronic Disease Self-Management Program. It's kind of the parent program whose kind of structure and backbone really underlays all of the other programs in this suite. The second bullet point you see there, Tomando, is really just the Spanish adaptation of CDSMP. And next, there is a diabetes self-management program. And then lastly, in green, the Cancer Thriving and Surviving program. So I bring this up just to let you know these programs are very tightly interwoven, and that'll just help you understand what we're going to talk about a little bit. Without boring you to tears on the history of these programs, I do want to let you know these programs were originally created at Stanford University in the mid-90s. Since that time, they've obviously gone through version revisions and whatnot. There's a solid 30 years of published research on these programs. Tens of thousands of participants have gone through these programs nationally since they've started. There is an implementation of these programs in every single state. As I said, we call this implementation HealthyU, but if you go to a neighboring state, it's going to be called something else because we're allowed to brand it however we'd like. Wyoming was the last state to get this. We received a program license and have been administrating it since about 2016. We have a network of around 80 facilitators, leaders that are in communities actually doing these programs and presenting these materials. And I think we're sitting at around 500, 600 participants that have gone through these programs since we started here. Just to kind of further set the stage, these 4 bullet points here are things that were very important to the course creators as these programs were being developed. And I think kind of understanding these will help you understand really the flavor of all these programs. So the first and one of the most important bullet points here is that people, any person with any chronic condition, will have a lot of overlap, a lot of concerns in those problems and the sorts of things that they need addressed. Second, people with chronic conditions, they have to manage their chronic condition, but they also have to manage the impact that has on their lives and their emotions. Third, lay people, that is to say non-professionals, but just people that are interested in this material, can be operationalized to deliver these workshops, and they are as effective in teaching this as actual professionals that have a background in these topics. And lastly, the process, the way that these classes are taught is almost as important as the actual subject matter that's being taught. So workshop structure. This first bullet point is a little bit of a misnomer. I wish I kind of pulled it out for you. As we're talking about these different programs, some are more applicable than others to various individuals. That parent program that I mentioned right off the bat, the CDSMP, is open to any adult with any sort of ongoing medical condition. It's also appropriate for their caregivers or their family members, anyone that's involved in that medical management. Once we start talking about these specific programs, the diabetes program, the cancer program, those are obviously more closed to people that, are actually going through those stated conditions. But just so that you can see a little bit of what workshop participants are actually going through, workshops are 6 weeks long. Participants meet just once a week for around 2.5 hours. So it's about 15 hours of workshop involvement. And these workshops are put on by a pair of community members that went through a certification process to teach this material. And class sizes out 8 to 18, just to let you know that. Workshops are very participatory, which I'll talk about more later. So relatively small groups work the best for the sorts of activities that are involved. Okay, so what are participants actually doing? What is this course material really like? The most important thing I can tell you about these programs is that there's a very serious emphasis on building skills and helping participants change their behavior, rather than educating them on any disease state. The sorts of subjects that are really driven home are decision-making, action planning, problem solving. Those three are something that we spend the most amount of time in our workshops talking about. Talk about things like developing techniques to deal with frustration, fatigue, pain, isolation. Again, you can kind of see that those are problems that underpin any sort of disease state. We also talk about techniques and processes to evaluate new treatments and why it's important to use medications appropriately. Another huge topic that we spend a lot of time driving home is effective communication. And that's communication with family, it's communication with friends, and very importantly, health professionals and any sort of person that's on their medical team. We do spend a little bit of time talking about appropriate exercise. It's not an exercise class. It's not a weight loss class. It's not a nutrition class. However, you can't talk about these topics without weaving those in. So let's talk a little bit more specifically about the Cancer Thriving and Surviving program. That's why we're all here today, right? Some of the topics that are most some of the topics that are part of this program that are not part of that parent program or any of the other programs are up here on the board for you. So things like fatigue management and getting help in that arena, managing pain, living with uncertainty, making future plans for healthcare, body changes as they relate to cancer, and making decisions about treatments and complementary therapies. And lastly, relationships and how cancer affects them. So, before we talk any further, just jumping into participant outcomes here. Like I mentioned right at the start, this program's been around for a really long time. I can't take credit for its creation. These are the sorts of outcomes that have been really well demonstrated over the last decades. First, and most importantly, participants report just an increased general health. That is to say that their quality of life is better after going through this course. Their depressive screening scores are lower. Self-efficacy is increased, which makes a lot of sense since that is one of the most important things that we're working on in this workshop series. We also see increases in activity. They feel as though they can communicate with their physicians and have more meaningful conversations with them. They also see increased energy levels and better sleep. On the other side of the columns here, we see participants reporting fewer unhealthy days. They feel as though they have less fatigue. They feel as though they have less limitations in their daily life. And also very importantly, we see a decrease in unintended interactions with the healthcare system. So less hospitalizations, less emergency room visits, less unplanned visits. This number that you see in the lower right-hand corner is not specific to the Cancer Thriving and Surviving program. That's the overall CDSMP number. But participants having gone through this program will see an average estimated decrease of out-of-cost pockets in the $364 range. And that number comes from a national study, several thousand people a couple of years ago. So I know I'm kind of flying through material here, but I did just want to, let you know that this program, there's a lot of different ways to become involved if anything we're talking about is interesting to you. Firstly, I'd love for you to be a referring partner. If you're working with individuals, if you have patients, I'd love you to let them know when we're doing workshops and be pointing them in my direction. If you want to become maybe a little bit more hands-on involved, we'd love to be able to host workshops at your location. We'd love to have you be putting those workshops on, or patients or associates that you all work with. Love to train people in this program so they can go out in their communities and do it. And lastly, you're all here because you're looking to make changes and kind of guide the conversation in this realm. So if you have ideas for us about how to have more creative partnerships to get this workshop out there within the state, or different ways that we can help implement it, I'd love to hear those too. So I realize I really flew through things, but does anyone have any questions? Anything I didn't really cover very well that you'd like to hear a little bit more about? Oh, yeah, I see lots of hands.
I was just wondering on the coordinators, do you have those? Are they in each county? How do you go about doing that?
Yeah, our regional coordinators, we have 4 of them. So we drew our own lines in terms of regions in the state. But if you imagine kind of the 4 corners as drawn out most by county lines, that's how those are divided. At the moment, we do have a vacancy in one of those positions. One of our coordinators did just move on to another position. However, the others are still there, and they all know the players. Yeah.
Okay. All right. Thank you.
Sure.
My question, since you're through the Wyoming Center on Aging, do you have age requirements, restrictions? Are we just all aging? How does that work?
We all are aging, aren't we? No, as it results, really any of our programs are not age restricted. Obviously in terms of demographics that we're targeting, we're generally looking for the 55 and over demographic. However, HealthyU specifically is open to anyone that is an adult, anyone 18 and over. We have had participants that are not even adults yet. And we encourage that participation as well. From a grant reporting standpoint and data collection, we kind of we exclude them from our pools because that's what we do. But we have frequently had even minors that want to attend with their parents or attend with their grandparents or that sort of thing. So we are not age limited really in any ways. Great question. Thank you.
Thanks, Larry, and I'm holding the mic, so I get to go next. It's great to see somebody else from Laradice. My question is just around the programming and just to clarify. So is it nationally then these programs are developed and then you are offering them here in Wyoming?
Yeah.
And I see you saying yes. So is there any opportunity then for the workshop facilitators to have Wyoming specific materials then injected into that curriculum? So it can be flexible, I guess, to what's going on locally. Yeah. Thank you.
Yeah, fantastic question. So the example that I like to use describing kind of the program structure is, if you think about If you think about like the American Heart Association and the way they offer CPR classes across the country, no matter where you take that class, it's going to be the exact same program. You're going to get the same exact information out of it. So from a course creation, course modification standpoint, we don't have a ton of flexibility. However, one area that we can make a lot of, I don't want to say concessions, that's the wrong word. One area that we're allowed to have a little flexibility is in kind of the before and the after programming and the breaks. As you can imagine, 2.5 hours is a long time to sit 15 people down and lecture at them. The class is not like that. There's a lot of participation, there's a lot of brainstorming, there's a lot of participant engagement. And of course, there's a lot of breaks too. So those individuals, those facilitators that are putting the class on, will generally help, either partner with me or other people in their region to provide materials, provide resources that are applicable to that region, and a lot of times, answer more specific questions than are kind of built into the course. Yeah. One other thing that I'm realizing right now wasn't up on a slide anywhere. Like I said, we're sitting at around 500 participants that have gone through this program here in Wyoming since 2016. We, unfortunately took a very large break during COVID. As you can imagine, it was just irresponsible to get groups of people with multiple chronic conditions in a room together. So we're in a real rebuilding phase here. And thankfully, we've been in a position for a while, and I hope to continue staying in that position to continue offering this program, free of charge to all participants. So this isn't something that we've charged participants for, and it's there's no signs of that changing anytime soon.
Hi, I think that was another great presentation. I think that sometimes important information is delivered in sometimes mellow tones and not with a lot of fanfare. And this is great. This is, it's a cognitive approach to complex problems associated with chronic disease. And I think that is a fantastic model. And I think that, and you said something, I think very important, which may have slipped under the radar, but that there's data from your program showing that people who go through it have improved quality of life and decreased scores with depression. And I don't know what those numbers are exactly, but that is really important information for this group, like for the survivorship work group, for example. And then we had this meeting this morning, the steering group, about bringing stakeholders onto the steering committee. And what is the value add for these organizations? Star, you were talking about the fact that you were bringing together a group of cancer center directors. And this is exactly the access to these programs and analysis is the symbiotic relationship that we have, where we can give this program and funnel it to the people who need it, and the people who would be utilizing have access to the fact that these programs exist, and their patients will have decreased depression scores, increased quality of life, and everybody wins. So I think that this is a perfect example of a great program that's out there, and that if we can harness it, leverage it, everybody wins. And thank you for being a part of it.
Yeah, thank you. I appreciate the comment. I completely agree with you. Yeah, I feel like sometimes I feel like a broken record saying it over and over, and then sometimes I think I neglect to say it because I feel like I say it all the time. But one of the things that I'm most excited that participants get out of this program is that feeling of self-efficacy. When you're dealing with any sort of diagnosis, and especially a cancer diagnosis, it's impossible to feel like you have complete control over the situation, because you don't have complete control over the situation. So anything we can do for those participants, for those patients, to help them stack the deck in their favor in terms of giving them some control over the choices they make, some feeling of control over the outcome that they eventually have, is a huge win for me as well. So, thank you.
I have two questions. First is, you said 500 participants to date. Was that for Thriving and Surviving or for all HealthyU? I'm
That was
curious
for-
about the self.
Yeah, that is for all of HealthyU. Yes, the Cancer Thriving and Surviving program, while its creation is not new, us taking it on as one of the programs that we're trying to do across the state is relatively new. We are at a grand total of 1 completed workshop. Dama and Stephanie actually were the facilitators for that workshop. So here in Wyoming, in our implementation of CTS is still in its infancy, and we're looking to train more and more people. The way our program works, I apologize for not kind of going into the weeds on this with you earlier, is that core program, CDSMP, is the baseline training for how to run the program, and how to be a leader, delivering information in the style and the method that the course creators wanted. Once we have people trained in that program, it's a relatively painless process to cross-train them, we call it, in these more specific programs. So we have a large network of leaders that are trained in the base program, and those who have an interest in the cancer programming or a population to actually deliver it to. We're bringing them on board and getting them trained, and hopefully we're looking to see kind of a bit of an explosion here in workshops happening in the coming months, which would make me very happy.
Question.
Yeah.
Could you speak a little bit to like promotion, recruitment, and like any successes or challenges you've had in that arena and how we might be able to help you?
Sure. I'm slowly coming around to the idea that it's incredibly difficult to direct market to participants. You can't just put an advertisement in the circular or a post on Facebook or spread the news that a workshop is happening and then actually reach the people that you're trying to reach and actually get those participants to show up in the door. So, workshops that have been most successful, both CTS and in our general HealthyU classes, that have been most successful are those where we have very strong referring partnerships, where the leaders or myself have an association with the medical center in that area, with the community center, with the senior center in that area. And we have a very high quality participant pool to directly get in front of and tell them about the benefits of the program. This doesn't affect the CTS program because that is a very specific program, but our parent program, the CDSMP, is extremely difficult to market to people because when you stand in front of someone and you say, if you have a chronic disease, you should join this program. That's not something that resonates with a lot of people. Many people do not identify as being someone with a chronic disease. It's much easier to talk to a group of diabetics and say you should do this diabetes program, or someone with a cancer diagnosis and say you should do this cancer program. When you're speaking in such generalities, a lot of people will say, no, I don't have any chronic conditions. I just take 5 medications a day and, I'm at the doctor once a month. So it can be very difficult to market broadly to that group. And again, that's where those referring partnerships are so critical for us, because patients trust their providers and they trust, other people that are involved in their health. So that's what we're leaning into.
Thank you.
Thank you.
For the work you're doing.
Could you elaborate a little bit more on some of the other programs in the chronic disease field and how, just kind of like Dr. Van Doornik talked about, this continuum of care, of how some of that work isn't necessarily just about cancer, but it's reducing risk factors for the chronic diseases, which cancer is also included. So can you touch a little bit more on just the standard HealthyU classes, and then if there's anything that we can do to help promote those classes, not just the cancer? I mean, obviously I'm going to put a plug in for the cancer and surviving one, but in the general sense.
Yeah, definitely. One thing that's really interesting with the Cancer Thriving and Surviving program is, as you might imagine, the course creators, they created this specific program and then they wanted to study its efficacy, and they wanted to study its efficacy relative to the program that they'd already been using for 15, 20 years. And very interestingly, the participant outcomes, there's not a huge disparity there because the Cancer Thriving and Surviving program is targeted to that demographic. they do see better outcomes among that demographic. However, there isn't this precipitous drop off for the general CDS-MP. So all that to say, while I would prefer to put participants that are in some stage of cancer survivorship in the CTS program, if that's not available geographically, or if they're not interested in participating in our virtual classes, they're still going to get really, really good outcomes in the base CDS-MP program. And I think the reason for that is that the base CDS-MP program, like I kind of mentioned before, really focuses not on educating patients about disease states. There was some talk earlier about how damaging and how challenging it is participants that patients that just go online and they'll do their own research, or even if they're not looking for information, are just bombarded with this is how you should be taking care of your disease. And that's not the focus for CDS-MP at all. Instead, the focus is really about how to evaluate the decisions you're going to make. What's a good strategy for evaluating what you're being told, and who should you be trusting versus who should you not be trusting, and how do you ask questions that are actually going to get you the answer that you're looking for from your providers. So does that kind of answer what you're talking about, Star? Thanks. Well, I really appreciate the time. I have a small stack of pamphlets and some one-page descriptions of the program. If you're interested in taking any of those, I'll pass them out on the tables, and please, feel free to find me throughout the day, and we'll chat about anything you'd like. Thank you.